He had hair transplant. He paid $1 a graft. They literally sewed the wound edges together and didn't really trim the hair in the back and sewed all that hair into his wound. I took him back and I was like, my goodness, I mean, this is serious stuff. You have to do your research.
Most people never hear what really happens when overseas hair transplantations go wrong. We do, because patients often come to us to get them fixed. Today, we're sharing some of the worst cases we've ever seen. Men who woke up after getting 4,000 grafts pulled from their heads without their knowledge, thinking they were getting 1,000 grafts. Patients sedated without consent and left in agony for 12 hours. Infections so severe, people came to us begging for help. This isn't about shaming anyone who went overseas. It's about showing you what really happens behind the flashy Instagram ads and the inexpensive promises. We want to help you avoid the same mistakes.
Today, we're going to talk about overseas hair transplants and why patients are going over there and kind of our experience with some of truly botched jobs. And this is, I'm not trying to demonize patients going over there or demonize clinics, because there are some patients that do well. There is a much higher percentage of folks that don't. You know, we had a patient where we did 2 cases. I actually did like 3,500 grafts, all FUE from the back of his head. Super happy. And he said, you know what, doc, I'll call you, you know, if I need you. And then ended up going overseas. They took 4,000 grafts.
Oh.
But prior to me doing my procedures, he actually had a strip procedure before. So with that, yeah. So with that strip, he probably had like 2,000 grafts taken. Then I
2,000 and 3,500.
3,500 between 2 of my procedures. And I felt like his donor site was pretty maxed. I said, we might need to start going for the beard or the chest. And then goes over there. He was just wanting a little touch up, maybe 1,000 grafts.
And they did 4,000.
They completely sedated him. And he woke up about 12 hours later. They took 4,000 more grafts. And the hair is terrible. It is, there's literally no hair on the sides, especially on this left side.
Because they've over-harvested.
Oh, gosh. And so he came to the office 2 weeks after he was there, and he was just devastated. What did I do? And he's like, I have no recourse. We're going to help him, but it's going to be, you know, quite a process. And it may take a couple cases to get it done, extracting from beard and chest, putting it back into the head donor, taking around the rim and using medication management to get this better. But it's not something he signed up for.
No, I mean, what a red flag when you're going into a procedure and you're sedated and then you wake up horrified. I mean, that's a terrible story.
Oh, yeah. I've heard other stories of, you know, patients having very poor pain control with a massive language barrier. Like there was one of my patients said the translator is there for just 2 hours. It was a 14-hour case. They took 5,000 grafts. And I was seeing him because we were putting beard hair back into his donor site. He said that the pain was so bad that he just said I was like a wildebeest, just, you know, giving up to the lion. You know what I mean? Just I'm done. And he felt like he, and these are his words, felt like he was on a spaceship going to Mars and never coming back. He said, I'm this tough guy from Jersey and I'm literally weeping, and they showed no empathy. If anything, they were almost laughing. And this is a true story. I mean, it's unimaginable, really.
I know. I mean, I think on the other extreme, you know, we're taking care of our patients. And one of the things we always say to our patients is if you're experiencing any discomfort, stop and let us know, because we could administer some further anesthetic because we want to keep you comfortable.
In a safe manner.
Yes.
Yeah.
Because you could only imagine being uncomfortable while, you know, they're implanting, you know, pen after pen or, you know, slit after slit thousands of times.
Yep.
I can't believe that patient was able to sit on the table. I think I would have ran out.
I don't know.
Oh,
you know, I mean, he was almost brought to tears just talking about it. He was just really emotional, a lot of stress, post PTSD from that event.
And then we talk about, you know, patients, they have a procedure they're unhappy with the result. They have no recourse to obviously fly back.
Mhm.
So, they don't know what to do. And a lot of times they'll come to us to help them.
Yeah. And a lot of times they're a week or two or a month out, and they've got, small little abscesses or ingrown hairs, or, we rarely see scalp infections, but I've seen them. What do you think the reason people would actually go overseas to get a hair transplant?
Well, we do see this question come up in our consultations with patients. They'll
Yeah.
say, why should I choose you when I can fly to another country and have a hair transplant? And it seems to be that's what everybody's doing.
And it's what, like $1 to $2 a graft or something?
Yeah,
Yeah.
it's a crazy number.
Yeah.
It almost doesn't even make sense.
No.
They go abroad and they get these big numbers, and then they come back, and in our experience, we're seeing the patients who've had complications,
Yeah.
and now they're back in the States, and they're in a bad position.
If you leave the country and go overseas, essentially, you don't have there's no jurisdiction that's going to protect you.
Right.
There's no state medical board or federal agency that can step in and be an advocate for you. And I hear this a lot. They thought the doctor was going to be involved. There was no doctor involved. Many times they get fully sedated for 10, 12 hours, not knowing what's going on. And they wake up not knowing how many grafts were just taken.
Very misinformed.
Oh, yeah. I think people get enticed into this thing that if a clinic has 1 million followers on Instagram, that they must be the place to go.
Right, right.
You know what I mean?
They buy into the sales pitch.
Yes.
They're going to get flown over there. They're going to get picked up by a limousine.
Yes.
They're going to stay at a fancy hotel in the city.
Yeah.
They're gonna, then they're gonna have this hair transplant.
Yeah, I mean, they've done a tremendous job building themselves up on Instagram and TikTok, but that perception is false. And we've seen it time and time again. I had one patient, this is probably back in 2016. It was a Friday afternoon. I was just about to leave. He spoke very little English, and I think he was originally from Mexico, and came into the office and said, "I need your help." He had hair transplant where they did 2 strips at the same time. So they did one higher up in his donor area and lower in the donor area, which is a big no-no. And he paid $1 a graft. They literally sewed the wound edges together and didn't really trim the hair in the back, and sewed all that hair into his wound.
Oh,
Both wounds. And I took him back and I was like, my goodness. I mean,
right.
this is serious stuff.
It's an abscess.
Yeah. And I worked on him, I'm not kidding, for an hour and a half, pulling hairs out, decompressing abscesses. And he actually had him come back 2 or 3 more times. And I felt so bad for him. It's one of those things. I did it at no cost because it was the right thing to do. This guy was absolutely suffering. And the amazing thing is, getting rid of all those abscesses and hairs, every time he came back, the healing was miraculous. It was great. But he didn't have any recourse other than to literally beg on a Friday afternoon, "Please help me." And that he was suffering. I think he was destined to have a severe infection.
Oh man.
Yeah. And so immediate action was required, especially for younger patients. I'm talking between like 20 and 30 that are maybe more skilled at Instagram and TikTok. And again, I'm not, and you're not in the business of convincing anybody anything. We're here to give you information and give you options. And we're busy enough. We're happy to help, but we're not trying to entice people. But they are enticed by the glam, by the number of viewers, and it's kind of the in vogue thing to do, to go over there. Or you travel to England and everyone's got bandages on their head,
The flight home, right?
because they're connecting through Heathrow, Yeah.
This isn't a sales pitch. This is because we want to convey information to people out there about hair restoration. And
Yep.
what we offer and what to look for and the red flags to avoid. And there's a lot of information on our website with the different podcasts that kind of inform our patients.
You have a specific question, as a viewer of this show, send us a comment. We respond to every comment.
Yeah, absolutely.
And we think that it's a great way to support the community of people that have hair loss. And in the United States, it's more than 80 million people. It's crazy. But this industry is exploding. The growth potential is massive, but it also means that there are a lot of new people coming in that don't have the experience, maybe don't have the whole thing figured out to provide the best results and keep you out of trouble. I have never had a single patient that I feel that I could safely do 4,000 grafts from the donor site at one time. It's impossible to do it safely.
Mm-hmm.
You're taking hair next to each other, which affects healing and contraction. It creates a whole, spiral of bad things.
Right.
And the sad thing is, like, the people that are over harvested with 4,000 grafts, if they would have done 4,000 grafts in multiple procedures, 2 to 3 procedures,
Yeah, spread over a year or
yeah,
2 years.
and not make that first procedure like this mega procedure to get as much done as you can, and you're monitored and followed, and the doctor is really cognizant about managing a bank account. It's like being a financial planner and you're managing somebody's money, If I'm managing it poorly, you're going to be probably
Right.
firing me or getting pretty upset. You know what I mean?
Dollar cost averaging, right?
Yeah. But the problem with hair transplant is it's easy to go from one clinic to the next. And the bad clinics don't care. They did their procedure and they move
Mm-hmm.
on to the next person. And they look at they're not looking at the individual. And it's just important to have that mindset.
Yeah, yeah. I mean,
Yeah.
we take a lot of pride in our post-procedure follow-ups
Yeah.
and have routine scheduled, consults
Yeah.
post-operatively at, 6 months you're going to meet with us and at 12 months you're going to
Yeah.
meet with us. And, we're going to make sure things are.
And what do you think about the final billing done in the day after we get all the grafts out?
That's something I always share with patients during the consult. I'm like, listen, we're giving you an estimate and we say 2,000 grafts. Um, we're not going to collect anything from you until we know the actual
Or
number,
the final balance.
the final
Yeah.
balance.
Yeah.
Yes. We're not going to collect the final balance until we know the exact number. So a lot of times, we plan on 2,000, and as we're doing it, we realize you don't need 2,000. 1,750, for example, is going to give you the results you want.
Or we have people that 2,000 is not obtainable in one procedure.
Yeah, and we
It can
have
be
it.
done in multiple procedures or second procedure, but it's not safe.
So yeah,
Yeah.
we're very open and candid with the patient. We're not going to bill and collect that final installment until we know the number.
Yeah.
Um,
And we don't sedate people generally. Some people that have high anxiety, and it's very occasional, but we can do the nerve blocks and make people comfortable.
mhm.
But in my mind, and I know with you, I mean, we want our patients to be fully cognizant and have a great experience and remember that great experience, but also have a memory of the fact that, you know what, we said we were going to do 2,000 and we can only get 1,750, or we got 2,000. We're very transparent with our counting, so everybody feels comfortable. We don't have any reviews. I didn't get as many grafts as I thought, but we see it all the time.
Yeah, I mean, we
Yeah.
are extremely cognizant of that. And,
Yes.
in the morning time, we are counting and keeping track of every graft
Yeah.
we harvest. Um,
Yeah.
and like you said, the patients, while comfortable, you're not sedated, you
Yeah.
are aware of what's going on.
Sure.
Um, so there's trust, and then also at the end of the day, they feel well, they're not in pain,
Yeah.
they're not recovering from anesthesia and
Yeah.
groggy and
Yeah.
having trouble.
Oftentimes drive home by themselves.
Yeah,
Yeah.
yeah.
So I think we're talking about kind of overseas hair transplantation, the kind of the glitz and glam and the attraction. And if you're a patient watching this video, you need to be cognizant to the fact that you have to do your research. There's no like time frame to get hair transplant. And oftentimes hair transplant isn't the solution, or maybe not the right solution for you. You can't compare everything to the glitz and glam that you see in Turkey or Mexico or any other international place that's heavily marketing.
Right.
You also need to look at some of the resources, and some of the great resources are the ISHRS, which is the International Society of Hair Restoration Surgeons. They have a great website. They are very proactive on this thing called Fight the Fight, where they're fighting these black market clinics that are just literally preying on patients. So that ishrs.org is a great.
Yeah.
The next one is the IAHRS. That's the International Alliance of Hair Restoration Surgeons. I'm part of that. There are about 100 in the world, and really focus on empowerment. I think that's the biggest thing. I mean, all these videos that we do and even the talk today, it's really to empower the patient, the consumer, to make the right decisions to move forward and not end up being preyed upon and having bad results and spending more money and just despair.
Yeah.
People are just in despair when things go bad.
If you're considering hair transplantation, do your research and don't rush. If you found these stories helpful, subscribe so you don't miss the red flags we'll cover in future videos. And leave a comment with your questions. We respond to everyone. Thanks for watching.